Hello, my name's Dorothy Kamaker, and together with my partner Alicia Dunn, I run a company called Patient Advocates Australia, which operates Australia-wide in the regional areas and in the cities. And we support patients in the healthcare system, the private healthcare, public healthcare, aged care, mental health care, the NDIS, and we respond to calls from clients who are concerned about issues that have arisen for a patient in one of those systems. The person who calls us can either be the patient themselves or sometimes it's a family member of that patient. And in this short video, I would like to describe one of our roles, which is that of case managers. It's one of the commonest roles that we take when clients call us. The concerns that clients describe to us when they ring up, the standard of care isn't good enough, or the tests are not being done, or we don't understand what's happening with the tests, or it seems like discharge is going to be too fast or too slow. Those are often matters of case management. And I've been a patient and had a family member who's a patient in the public health system, and I understand exactly how that the case management faults in the system can cause very poor outcomes and tremendous stress and anxiety. So what we do is we work to make the management of the system within the hospital or within the community or in an aged care setting, mental health care setting, we make the management better so that the outcomes can be better. So that a typical call to us that can be categorised as a case management issue is where someone will ring up and say, my father is being treated at X hospital or by his GP for blackouts or for delirium or for some issue, falls perhaps, and we don't believe that he's being properly managed. We don't think that the problem he has is getting better. Sometimes they will say he is getting worse, his condition has deteriorated, and the treatment does not seem to be helping. It's not uncommon for us to hear that the treatment has simply included an awful lot of medications, and now the patient who went into hospital with a certain condition has had a huge number of medications added to their regime. Their original problem is not any better, and now they're on a huge number of medications. So often the issue is with patients where the management is at the base of the problem, is that there is a lack of collaboration between the treating teams. So it's not uncommon. I had a case like this just last week where an oncologist and a GIT surgeon were simply not talking to each other. That's bad case management. The oncologist was not communicating, collaborating with the primary admitting doctor, who was the GIT surgeon, the colorectal surgeon. So case management is where there are gaps in the management that need to be filled, and where the treatment needs to be coordinated better so that the outcome can be better. I seldom find that there is a doctor out there whose level of expertise is the real issue, but it doesn't help to have a spectacular surgeon or oncologist if the outcome is poor because they are not communicating with each other, or they're not incorporating each other's management in their plan. So good outcomes are not down to brilliant minds, they're down to very good case management towards a certain goal and a collaborative approach to get there. So one of the complicating factors these days is that most patients in the public hospital system will have complex health issues they will have 2 or 3 serious health issues. If you go in with a urinary tract infection and you have a level of delirium because of that, it is very likely that you have got some other conditions that coexisted or that are caused by that urinary tract infection, which has led to sepsis or a serious infection, and you will have complex issues. And where that happens, the outcome is totally dependent on a collaborative approach between specialists. And it is very common for my clients to call me up and say, my father's been in hospital with delirium, and now they are saying that that is actually dementia rather than it's delirium. But it came on suddenly. We don't think he's got dementia. There's been no consultation with a neurologist or testing that way. This is the opinion of the urology team who are treating him for his urinary tract infection. And this is a management issue. It really is just a gap in the system. It happens in general practice. It happens in hospitals. There was a time, years gone by, when there was a case manager on every medical and surgical team in a hospital. They don't exist anymore in the public hospital system, or by and large in the private hospital system. They were very expensive, and in GP practice, case managers have been replaced by practice managers, and practice managers do something very different. Practice managers look after the business model of the practice. They don't look after the clinical management or the treatment management of the patients. So case management is something that made the system work better years ago, and a lot of our role is case management. So another of the issues that is significant for us in terms of our clients' concerns is that we are frequently told, if there are several children of an adult who's a patient in hospital, they are frequently given conflicting and totally different communication, information by every different doctor they speak to. So they will say, I rang up the other day and I asked what was happening, and I was told, look, it's looking as if she's had a TIA, a mini stroke. So we're going to have a neurology examination done, and we're going to have what's called Dopplers on the carotid arteries done. We think this is probably a TIA. And then the next child who speaks to another doctor on the same team will say, we're actually thinking this is probably delirium and it may be an underlying infection, and we're going to have an examination of the valves of the heart because we wonder whether there isn't an infection in the heart, and so it goes. So there is often an issue in terms of case management of coordination between the medical management teams that will explore systematically exactly what a symptom is caused by and work their way through that and communicate back to the family what they are thinking is the likely cause, and then move on to the next issue that is a possible cause for the symptom. So often, because there's poor case management, each of the teams that's having the thought, is this a TIA? Is this delirium caused by an infection? Is this down to the diabetes being out of whack? Each of those teams will add a separate treatment, often a separate medication. And I'm often told by the relatives or the patients who ring me up, I've been in here 2 weeks, I came in on 4 medications. Right now I'm taking 13 medications. I've got more side effects from those medications than I've ever had before I came into hospital, and I feel worse, or my father looks and is worse than when he came in. That's down to often poor case management. With good case management, the doctors who are looking after those patients can produce an excellent outcome, but they are not putting all the information together. They are not closing the loops. The communication, the collaboration between the teams can be terrible. I had a patient who went in the other day who was the oncology patient had been an oncology patient and went in for a surgical problem, and the issue was whether or not, from the surgical team, whether or not that patient should continue with oncology because it may need to be stopped in order for surgery to happen. And 5 days after the patient's admission, the surgical team had not contacted the oncology team. Now, that's bad management because that meant that the ultimate surgery would be delayed by that period of time. So, good case management would have been, well, what I would have done in the first instance when I was speaking to the surgeon is I would have said, has the oncologist been spoken to? Is this oncology window going to be exploited? Can we look to using these 5 days or 6 days off the chemotherapy for the purposes of getting the surgery done faster? I would have said, I'm just going to contact the oncologist just to make sure that he has his input recorded in the notes. And that closes the loop much better than just leaving it to an intern on the team to perhaps contact the registrar on that team. And the contact is usually by writing a note. And in the patient's continuation notes, that note may or may not be read by the oncology team. So this is bad case management and this affects patient outcomes. So what we do a lot of is we improve the system and the treatment and the management that the hospital or the GP is providing in a way that works towards really, really good outcomes. So in the end, we are pretty sure that we can improve patient outcomes without ourselves having any medical input at all, or any nursing input, even though that's our background, but by making their system work better for our clients. And certainly what happens is that our clients will say to us, gosh, I just had a conversation with the oncologist and he just called me and he said to me, look, I think what we need to do is cease the chemotherapy for the time being, do the surgery and start the chemo up 2 or 3 weeks after the surgery. And that happens because I've left a message for the oncologist to be in touch with the surgical team to let them know what best advice there would be about the chemo. So case management is something that makes a huge difference to patient outcomes, and that's something that we specialise in. And we do it in mental health care. We certainly do it a lot in aged care, and we do it within the NDIS as well. So case management is something that I think clients need to be aware of. They may not understand how case management works in a hospital, but if you think, I don't think this is working well for my father, I don't see that this system is getting it right, don't delay in calling somebody to help you, because time is your enemy in poor case management. Get yourself a patient advocate, even if it's just to give you advice about how to intervene in the system, but get yourself a case manager via a patient advocate as soon as you possibly can.